to Tallahassee, includes your viewing area. So our biggest providers are Life Management Center and Anchorage Children's Home there in Panama City. We work directly with them to make sure that all crisis community mental health services and Baker Act facilities, those things are funded, and we're giving the best possible services for that community mental health and substance abuse.
All right. Well, I mean, these are unprecedented times. Um, what kind of things in the mental health arena are you guys seeing out in our community right now?
Well, we have a tremendous increase in anxiety. We know that anxiety is the primary marker for psychological disorders as well as addiction. So we know that that exists in our community. We are trying to still receive new patients for mental health and substance abuse on a daily basis. We certainly want to work with them before it becomes a crisis, but we are equipped as well to do crisis detox and crisis stabilization if those instances do occur. So we know it's a problem. We know the anxiety is up. We've seen that through the Hurricane Michael, and we're doing everything that we can to put resources push forward as a policy in our state to help those people before they get to the breaking point.
What do what do people need to know to recognize the signs of either they're having an issue or a family member's having an issue? What are the signs of that?
Well, obviously with addiction, if you know someone is misusing either substances or alcohol, the obvious signs for that are they are unwilling to engage or unable to engage with their family or their work. So we know what that looks like for those that are addicted to abuse and neglect. Those are probably the easier ones. The other side of the coin with mental health is that if people become extremely retracted or if they become very, very aggressive, those are primary indicators that there's something different going on with your family member or loved
Uh, the other thing that we're sort of going through is isolation. We're being asked to stay at home. We're especially asking elderly folks. The governor's issued this order for folks over 65. Elderly isn't the right word. If you're over 65, I apologize. But for folks who are over 65, to sort of stay at home, not go out, that you're at risk. So what can kind of be done to sort of overcome that isolation we're all sensing?
Yeah, and that's we know that people that have anxiety, isolation adds to that, fuels the fire for that. So I think there's ways to try to maintain contact. I know with my family members and my coworkers, we've tried to use the old telephone, text messaging, FaceTime, teleconferencing. Those are all strategies to try to stay connected in the community. We've also have been advising our community to maybe not watch the news 24 hours a day. Set a schedule and decide where you're going to get your news from. I'm sure you're a great resource for that. And get your information a couple times a day, maybe three times a day, but it does not have to be 24 hours, 7 days a week. There's also any number of volunteer groups that are reaching out to the older community to try to bring them food and to try to engage them without breaking the social distancing rule. Still have conversations with folks because we know that that human interaction is key to a healthy mental stability.
And I imagine, it for a lot of us, it's not just the news that we maybe need to limit ourselves on, but it's maybe social media, maybe a friend or a family member that's, you know, freaking us out. I don't know. What else? What other kinds of limitations should we set as we're kind of dealing with this thing?
Yeah, I think now that we're a couple weeks into this, we know that uh, we need positive strategies. Getting outside where there's safe activities to do without being in a group. Getting some sunshine. We have been blessed with great weather here in the Panhandle, so we've had the opportunity for folks to be outside at safe distances. I think having a support system that you can identify and say, hey, these are my friends, these are my family members, this is my work team, and maintain healthy connections with them. Talking about things other than isolation, talking about and spend some time on things that maybe we never had time before. Reading with our children, asking questions of our older population about their experiences and their lives. So really that human engagement in a constructive way that doesn't always have to be about the epidemic.
The the other thing that's kind of I think happening as we're all going through this together, I'm me personally, I'm washing my hands an awful lot. And I'm trying to do sort of the things they tell us to do, but there's a fine line there between doing what you're supposed to do and maybe becoming obsessive. Um, what kind of advice would you give folks as they're kind of trying to do the right thing, but maybe don't want to slip over into germaphobe territory or some other kind of OCD kind of related thing?
Well, I think there's a far distance to go before you actually get diagnosed with obsessive compulsive disorder, or OCD as we refer to it often. I think there's probably not too much hand washing at this point. You probably can do that as frequently as you want, and it be still a positive thing. But to understand that we don't live in a really scary world. We've been here a long time, and we expect to continue being here. And this, I think, it's about perspective. Is it likely that I'm a candidate to be a recipient of this virus? If I do get the virus, what's the best possible position I can put myself in to take care of myself, to take care of others? And honestly, we have seen a great deal of very constructive behavior from folks. We always hear about the negatives, the spring breakers and people are violating kind of the rules. But there's also been a ton of positives where people are engaging in a healthy way. They're doing the social distancing, and they're spending time with loved ones, and that's what we've encouraged.
Are you guys seeing a rise in domestic violence or issues along those lines where people who could be away from one another maybe and maybe could control some things or maintain some things now they're kind of stuck together? And what would you say to folks that are maybe stuck in that situation?
Yeah, we have not seen that come in yet. So we do serve a large area. Panhandle is very rural. Life Management Center, our partner, has 6 counties of the 18 that we're responsible for. And we really rely on them to make sure those front doors stay open. So if you are in crisis or if you're in an unhealthy situation, I know Sheriff Ford in Bay County and or the domestic violence services in Bay County are there to respond. Uh, we understand and recognize that these are anxious times and there's financial stressors, and those stressors and anxiety will lead to some abuse of elderly, of children, of spouses. We hope for the best on that. We pray that there will be a positive ending to this. But when those instances occur, my chief responsibility, along with the sheriff and Med Is at Life Management Center, is to make sure that we can respond to protect life and make sure they get the services they need. And that's what really we intend to do is can we keep our workforce healthy enough and intact long enough that we can respond both during the event and then after this event is over.
Um, you know, right now, I think we're dealing with sort of the short term effects. What are your concerns over the long term? If this lasts, weeks and months and longer than that, what, how do people sort of continue to cope as this goes on?
Yeah, I think we've already seen that living in the Panhandle. We're coming off the wake of Hurricane Michael. So it feels like months to me. And I know for my children and for a lot of people in your viewing audience, it feels like it has been months already. And this is just one more thing. In fact, discussing with neighbors that kids have probably been out of school this year more than they've been in school with all of the things that we've struggled with through these two incidents. But I also think there's an opportunity, and that opportunity is to bring people together to understand what our priorities are. And we know that, again, there's going to be people that need mental health resources, they're going to need addiction resources. And my job is to make sure that we can keep those professional people in place on the front line, working every day in a safe and protected way to make sure they're there when they need.
And I assume that you guys are looking at sort of distance help, whether it's telehealth or some kind of video conferencing with mental health professionals. Are you guys working on that right now?
We are. In fact, there's a couple of announcements I can tell you. It was just this past summer that the First Lady of Florida committed to having telehealth in every public school in your viewing room. And we were able to partner with Bill Husfeld, the superintendent, and the governor's office to make that happen in every public school. So that while that is ramping up, we would expect it to continue on, even though school's been released. Education doesn't stop, mental health needs don't stop. So we will be relying on telehealth to achieve those outcomes. And I'm also very pleased to announce that FEMA just declared statewide for the state of Florida a crisis counseling program for every county to be made available resources for telehealth counseling. So I don't have a lot of the details on the exact dollar amount or what equipment or manpower will be dedicated to that effort, but I can tell you that it's very similar to what we saw during Hurricane Michael, which is going to be applied to the entire state. So I would suggest to you that there's a number of people that would benefit from crisis counseling, uh, and they will have an opportunity in a very public way to find out how to access that, and I would expect it to be very soon.
That's good news. Um, one other thing I wanted to ask you. I'm a parent, so the kids are at home. What would you say to parents who are trying to keep everybody safe and if not happy, at least well adjusted as we get through all of this? What kind of advice do you have for parents?
Well, just recognizing that it's permeated all ages in our community. So um, I hear children talking about corona, the coronavirus, um, frequently. My own kids talk about it. I've got a fifth grader that comes home talking about it, and when school was still in, of course, now that she's home every day, and the parents are talking about it, so it even seems like it's even more heightened. So I think saying to them that we don't know all the answers at this point, um, that affects very, very few people in the worst kind of way. But we want to be safe. We're taking these precautions. Most people seek a norm, and that's true for children too. They are seeking a normalcy. What is normal to me in Lynn Haven? What's normal to me in Chipper? And the idea is that, I'm still your parent. I'm here. I love you and I care for you. We're going to take these extraordinary steps and to make sure that our whole community is safe. And at some point in the very near future, we will return back to that normalcy. In the meantime, I would highly recommend a structure, and I think the schools are suggesting that you still get up every morning and get ready to learn, that you have a schedule to go about your education for children. And I think that is going to feel very normal for kids, even though it's being done in a teleconferencing way. And that's something that they can build onto as we return back to what we used to have.
Yeah, structure can be kind of hard to do when you're sort of on a weird vacation, almost a staycation. Ultimately, what's your biggest advice for folks as we go through this right now? What's the main takeaway you want people to have?
Well, I'm highly optimistic, and we need to make sure that the most acute care, so our hospitals and our law enforcement, our EMTs, our Baker Act facilities, our detox. We need to make sure that infrastructure is in place and that it's safe for people to go who really need it the most. And then beyond that, if you need assistance, if you need someone to talk to, there's 211 that you can always access. And then also we have Life Management Center as a primary mental health provider in Bay County and the surrounding counties. So there's ways to access supports if you are going through hard times. So if that means that someone in your family or someone at work or your child or yourself is having difficulty, there is a pretty abundant number of resources that can be accessed at no cost or low cost to the community so that you can get help now.
All right. Well, we're going to have some information on our website on where those resources are and how to get a hold of them. And for now, I want to just say thank you, Mr. Watkins, for joining us, and thank you guys for watching. And we'll see you again tomorrow.
Very good. Thank you so much.
Thank you.
Okay, thank you, sir. You're clear.